Welcome to our mnemonic video on the Rash differential. Let's get started. Today's story will take place in a Regency-era English manor. The weather is starting to get chilly in the mornings, so the maids have started a big fire in this heart-shaped fireplace. Flames are our recurring symbol for inflammation, and the flames inside the heart-shaped hearth should remind you of inflammation inside the heart, or endocarditis. Endocarditis presents with fevers, chills, night sweats, pleuritic chest pain, and cardiac changes, such as a new murmur or clinical signs of heart failure. It is most commonly caused by bacteria in the blood, and it targets the valves of the heart. Positive blood cultures, visualization of infected heart valves on echocardiography, and other symptoms outlined in Duke's criteria can help diagnose endocarditis. And the treatment involves empiric, broad-spectrum IV antibiotics. And then, of course, you can tailor your regimen later and target specific organisms based on culture results. Well, after starting up this fire, the most senior maid of the house staff has put on a tea kettle to boil for the family's breakfast. She was checking out the water in the kettle when the scalding water unexpectedly spills onto her. A staff member with scalded skin sounds like staphylococcal scalded skin syndrome, a skin disorder triggered by exfoliative toxins produced by some strains of Staphylococcus aureus. Now, patients usually present with macular erythema, followed by epidermal exfoliation or formation of thin-walled blisters that can easily rupture. And those are denoted by a positive Nikolsky sign seen on physical exam. So with that, you would just apply gentle pressure or a little rubbing of the skin, and that causes sloughing of the epidermis. Again, that would be a positive Nikolsky sign. Let's take a look around the rest of the manor. A house with ornate decorations, a huge fireplace, and enough wealth to keep a large staff will inevitably attract burglars sooner or later. Take a look at the window behind the maid where we can see a burglar scoping out the place. Burglar sounds like Burgdorferi or Borrelia burgdorferi, referring to Lyme disease. And this is the disease in which a tick acts as a vector. So we're dealing here with Borrelia burgdorferi or Lyme disease. There are 3 stages of Lyme disease. The first stage presents with the classic bullseye rash, known as erythema migrans. This is an expanding rash with alternating red and white rings that present at the site of the tick bite. Other symptoms of the first stage include fever, chills, fatigue, and flu-like symptoms. The second stage of Lyme disease is known as the early disseminated phase, and it can present with migrating joint pain, facial nerve palsy, and cardiac symptoms. The third stage, or late disseminated disease, can present with chronic joint pain and central nervous system symptoms. And the treatment will involve oral doxycycline for local disease and IV ceftriaxone if it's disseminated, so stages 2 or 3. However, if the treatment is contraindicated, as in the case of children where you don't want to use doxycycline, then amoxicillin is a good alternative. Now let's meet the family members, starting with the eldest daughter. This young lady is waiting for her mother, discreetly holding what looks like a used tampon behind her back. Back in the old days, one of the absurd ways that unmarried women would prove their virtue is by providing evidence of a menstrual cycle, or in other words, providing evidence for not being pregnant out of wedlock. Anyways, leaving a tampon like that one in for too long can lead to what's known as toxic shock syndrome, or TSS for short. Toxic shock syndrome is caused by toxic shock syndrome toxin 1, which is produced by staphylococcal organisms and is associated with not only tampon use, but really any kind of extended packing. So for example, this can theoretically occur with nasal packing after a nosebleed for a long time, or long-term packing of a surgical wound. Symptoms of toxic shock syndrome include a diffuse rash with widespread skin peeling, fever, altered mental status, and symptoms of shock, such as hypotension and tachycardia. Treatment involves removing the packing that would be the source of the sepsis, and then you would promptly treat with antibiotics. Let's take a closer look at the accessories she's wearing. This bracelet appears to have left behind a mark on her skin. You can see the red area on her wrist, and it appears to be very sharp, like a very sharp outline there, and it parallels that bracelet itself. Well, this rash in the exact shape of the object overlying it should give you a clue that it's likely a contact dermatitis, another differential diagnosis of a rash. Now, contact dermatitis is anything that contacts the skin and causes dermatitis. And conceptually, you can break it down into 2 ways. There can be just something that irritates the skin, like a metal or detergent or some soaps, or it can be allergic related. So, for example, a person that might have a sensitivity to a particular substance, like latex. And when it contacts their skin, then they get this allergic dermatitis. And in the case of allergic dermatitis, think about a type 4 hypersensitivity reaction. In any case, she's got contact dermatitis, whether from just being an irritant or an allergen. Her watch is the problem. And contact dermatitis presents a lot like this. There's an itchy, red, papular rash, and it's treated with steroids and antihistamines. And diagnosis usually is clinical, but especially in the case of allergic dermatitis, a skin allergy test can be useful in identifying the specific allergens, those allergens that can trigger that allergic contact dermatitis. In front of this young lady, we see a white dress with red splotches all over it, ready for her to wear on her big day of entertaining suitors. The cut of the dress and its style is beautiful, but those red splotches almost look like a rash, and you can see the daughter appears a little disappointed at this unusual fashion choice. Well, the rash-covered dress should remind you of DRESS syndrome, which is a drug hypersensitivity reaction. The word DRESS is an acronym for drug, D, R, rash, with eosinophilia, E, and systemic symptoms, SS. As the name suggests, DRESS syndrome can present with systemic symptoms, including a diffuse, itchy, morbilliform rash, as well as fever, lymphadenopathy, and even signs of multi-organ failure. And laboratory studies will reveal an increase in eosinophils, as suggested by the name, or at least the E in that DRESS acronym. Well, this white dress is not the only one, though. A little to the left, we see another red dress with some little white spots. The idea here should remind you of the appearance of Erythroderma, also known as generalized exfoliative dermatitis. Erythroderma is an inflammatory condition affecting the skin, causing redness and scaling that involves 90% or more of the entire cutaneous surface, as depicted by the appearance of this red dress. Back in the old days, they were impressively modest, so basically everything but the head would be covered by this dress, so that should help you remember the 90% or more of the body. Well, many etiologies are recognized as culprits for causing erythroderma. However, idiopathic development and allergic drug reactions are by far the most common causes. Treatment involves addressing the underlying cause, for example, stopping the offending drug and starting the patients on corticosteroids. Looking onto the wall behind, we see this beautiful painting of the Rocky Mountains hanging in the parlor of this house. This painting should remind you of Rocky Mountain spotted fever, another differential diagnosis of a rash. Now, the condition is caused by Rickettsia rickettsii, transmitted by its vector, the dermacentor tick. Diagnosis is often clinical by detecting the pathognomonic rash that starts at the wrists and the ankles, and then they spread centrally to involve more of the trunk and extremities. And doxycycline is the drug of choice for this condition. Although, as we mentioned before with a prior rash, doxycycline can actually be contraindicated in children because it's a tetracycline. For example, you don't want to damage the growing teeth. However, in this case, Rocky Mountain spotted fever is so serious that you need to give doxycycline even if it is a child. As part of the preparation for the day, the house staff decided to put their unique cover on the table where they will be serving food for the visitors. Notice that the cloth cover looks like a fluorescent fishnet. This idea should remind you of the immunofluorescent stain appearance of Pemphigus vulgaris, a hypersensitivity reaction where antibodies are formed against desmosomes, and those are proteins that keep the layers of the skin attached to one another. As you can imagine, if these proteins are destroyed, the layers of the skin will flake off easily. This separation of the layers of the skin is called acantholysis, and that leads to blister formation, and those blisters can slough off easily by gentle rubbing. And as we mentioned before, if this happens, this is called a positive Nikolsky sign. And these lesions can be found all over the body, depicted by this teenage son with blisters all over his body, as well as his oral mucosa, represented by this big gum bubble, which looks like a big blister coming out of his mouth. The idea of the fluorescent fishnet, which sometimes is referred to as a chicken wire appearance, as well as that son with the blisters and the bubble gum coming out of his mouth, are all here to remind you that Pemphigus vulgaris can be a cause of a rash that you should keep in your mind. Now, seated in front of this teenager, we see a lovely pie made by the kitchen staff for the eligible bachelors. And the pie looks great, except for its burnt edges. Perhaps the new cook left this pie in the oven a little too long. Well, pie is our recurring symbol for strep pyogenes, and the fact that it's burnt should remind you of necrotizing fasciitis caused by strep pyogenes. And this is where the skin cells quickly die and turn black, like those burnt edges of this pie. Local signs can include severe pain, bullae, crepitus from the gas present in the tissues, putrid discharge, rapid burrowing through the fascial plane and anesthesia, and systemic reactions like fever and shock can also be seen. And the condition is rapidly progressive and should be treated promptly with IV antibiotics and surgical debridement. The burnt edges of the pie may not be a hit with the guests, so the girl's mother decided to get a fresh honeycomb. However, she didn't notice the bee stuck into this honeycomb, and that very same bee stung her. Well, as you can see, her face has gotten swollen and blotchy, and she's scratching at a spot on her arm. Well, this pruritus, erythema, and swelling should remind you of urticaria and anaphylaxis, which are on the differential diagnosis for a rash. Urticaria, more commonly known as hives, is due to mast cell degranulation in the superficial layers of the dermis, and it increases the vascular permeability, which then leads to that edema. If severe enough, this reaction can progress to anaphylaxis, which is a potentially life-threatening allergic reaction. And treatment involves antihistamines, steroids, and in cases of anaphylaxis specifically, you can use intramuscular epinephrine. Now let's meet one of the younger daughters. She's standing next to her sister's dress and looking sullen. It's been a busy day in the household, and she's really just feeling ignored. No one has bothered to compliment her on her favorite violet dress. She was hoping to impress everybody, and nobody cared to comment. Well, more than just looking sullen, this girl also has red dots all over her arms and legs, and it appears as if she's come down with a mild viral illness. Well, this young girl with viral disease and red dots should just make you think of a viral exanthem, which is a skin rash caused by a viral infection. The presentation of a viral exanthem can widely vary according to the offending virus, and the treatment either way is supportive, and that rash usually resolves with resolution of the viral infection itself. Let's take a look at what the other children are up to. This young kid has had enough of the tedious formalities of the day, and he sat down on the floor to play some marbles. His red shooter marble hits the spiky obstacles that he put in the circle like you do when you play marbles, and that little activity caused his marbles to shear apart. Those red marbles should remind you of red blood cells, and the shearing of them when they hit those little spiky obstacles should remind you of microangiopathic hemolytic anemia, or MAHA for short. Microangiopathic hemolytic anemia is an umbrella term for a condition in which red blood cells are sheared apart by mechanical forces in the blood vessels, and that results in schistocytes. And you can detect those on a blood film microscopy. Classic examples of microangiopathic hemolytic anemia include thrombotic thrombocytopenic purpura, or TTP, and disseminated intravascular coagulation, or DIC. Both of these conditions should be on your differential diagnosis for a rash. Now, TTP is a condition where small clusters of platelets form, and then they plug up the vessels. And while the red blood cells try to squeeze by those clumps of platelets, they shear off, and that's what causes the schistocytes. Now, in addition to hemolytic anemia, TTP is accompanied by fever, thrombocytopenia, kidney injury, and neurologic symptoms. And the treatment for TTP is plasmapheresis. DIC, on the other hand, is a condition where the clotting cascade is abnormally activated systemically, and that leads to the formation of multiple microthrombi. And those also cause shearing of the red blood cells, very similar to TTP. And treatment involves identifying and treating the underlying cause, as well as supplementing with transfusions of blood products. Let's look at what this kid is trying to hit with his marbles. He seems to be trying to hit the middle of that target sign that the oldest son is holding. This target sign is the hallmark physical exam for erythema multiforme, or erythema multiforme, which is another on the differential diagnosis for a rash. Erythema multiforme is thought to be a type 4 cell-mediated hypersensitivity reaction, and it's most commonly associated with a herpes virus. However, other infections and drugs can also cause the same rash, and the rash typically begins symmetrically on the extremities and then spreads centrally, so in a centripetal direction. And the condition is self-limiting, but topical steroids can be considered. And this older son holding the target for his little brother is named Harold. And it looks as though Harold, the family's eldest son, was up to something in the woods before he came here. As a young athlete, he was training on perfecting his shooting at the target board. But when he heard that the visitors were coming, he went back home as quickly as a man could, which made him get a little sweaty. So he decided to unbutton his shirt and his jacket. Now we see a cluster of round lesions on his chest. Let Harold's name remind you of Herald Patch, the hallmark of pityriasis rosea, which is something you should consider on the differential for a rash. Pityriasis rosea is a self-resolving rash of unknown etiology, and it commonly presents with one initial Herald patch, followed by subsequent patches in a distribution similar to that of a Christmas tree, as depicted by this Christmas tree on his jacket. But what's that between his toes? As he was hurtling back home, he wanted to be there very soon. So he took a shortcut in the woods that was full of mushrooms. He ran into and stepped over mushrooms with his bare feet, which caused some mushrooms to not only stick to his feet, but also to his hat. Well, mushrooms should remind you of a fungi. And the idea of fungi between the toes of an athlete should make you think of athlete's foot, or Tinea pedis, which is a type of Tinea infection. This can also be known as ringworm. Now, Tinea infections commonly present with itching, scaling, and redness, and they can occur really anywhere on the body. And the name is actually determined by where on the body it infects. You call it Tinea pedis when the infection involves the feet, Tinea capitis when the infection involves the scalp, and when the disease affects the groin, the condition is named Tinea cruris, or jock itch, which we want you to remember by that gross jockstrap he happens to be holding. And a tinea infection is actually diagnosed with a potassium hydroxide prep, and then you'll treat it with antifungals. To welcome the suitors of the morning, Mr. Steve Johnson, one of the senior house staff members, is dressed to the nines in his tailcoat, or even dressed to the tens, standing in the corner by the doorway waiting for the suitors. But it seems like he's been waiting for so long in the sun that his face became red, flushed, and even patches of his skin appear to be sloughing off. Well, Mr. Steve Johnson, dressed to the tens, sounds like Steven Johnson syndrome and toxic epidermal necrolysis, or TEN-10 for short. And the red discolored skin that's sloughing off should remind you of how both of these conditions can present. They are both severe manifestations of a skin rash caused by drug reactions. And the only difference between those two is that Stevens-Johnson syndrome really involves only 10% of the body or less, while toxic epidermal necrolysis has over 30% of the body surface involved. Treatment involves discontinuation of the offending drug and supportive therapy that's similar to how you would treat a burn wound victim. Who is at the door? Well, it seems like today's latest publication of the news has just arrived. This little newspaper or page boy looks a little strange though. For one, he's got a purple knit beanie with green splotches and it looks far too tight and even causing some redness underneath it. A tightly fitting beanie is our recurring symbol for meningitis, since the beanie surrounds the head tightly in a way similar to the meninges surrounding the brain. And the fact that there are some green splotches should make you think of bacterial meningitis. If meningitis presents with a rash, that usually means that the underlying cause is a meningococcal organism, and further, that those organisms are in the bloodstream. Therefore, meningococcemia is another differential diagnosis of a rash, depicted by the red polka dots on this kid's long socks. Speaking of that boy again, he looks quite unwell. Perhaps he's been doing too much work running around this morning on his deliveries. We see his face is sweaty and somehow green at the same time to remind us of fever and vomiting, both of which can accompany meningitis. And he's grabbing his neck and flexing his knee as he steps into the house. And that can remind us of neck stiffness and its related signs, like Koenig sign and Brodzinski sign. Finally, he's shielding his eyes from the bright sun with his pamphlet, and that can remind us of photophobia that's often associated with meningitis. Diagnosis is with blood cultures and a lumbar puncture for CSF analysis, and the treatment is with prompt IV empiric antibiotics. Now we see a lady guest who has just arrived. She is wearing a bright red dress hiked up to her knees with long pink stockings and gloves, and those have red spots on them. And her hair is falling in long curls around her face to remind us of spiral organisms or spirochetes, such as Treponema pallidum, which is the causative organism of syphilis. And syphilis has 3 stages, and in the second stage, also known as secondary syphilis, patients can have a rash. Let the red polka dots on this lady's stockings and gloves remind you of the rash on the palms and soles that you would see in secondary syphilis. Screening for syphilis is done with rapid plasma reagent, or VDRL tests, and after you've screened for it, you can confirm it using the fluorescent treponemal antibody absorption test, or the FTA-ABS. And that's the gold standard. And the treatment depends on the stage of the disease. But basically, you break it down like this. If the patient has primary, secondary, or latent syphilis, provide the patient with intramuscular penicillin. But if they have neurosyphilis, then give IV ceftriaxone. Let's take a look outside the house. Right outside the front entrance, you can see 2 beavers who have burrowed into the front lawn of the manor. The burrowing made by these beavers should remind you of the linear burrows made by scabies. Well, scabies is a highly contagious skin infestation that presents with severe itching and a rash. Treatment involves topical permethrin and thoroughly cleaning all clothes and fabrics that are in the patient's household. And as if this day couldn't get any more dramatic, the roof is caving in. Shingles from the roof are raining down, narrowly missing this poor page boy. Well, shingle sounds like, shingles, a common name for the reactivated herpes zoster virus. Herpes virus can lay dormant in the dorsal root ganglia for decades And then later, they can reactivate with a painful vesicular rash along a dermatomal distribution. The condition is treated with acyclovir, but it can still result in complications, such as post-herpetic neuralgia. And with that, we've learned all about the differential diagnosis of a rash.